Germany may have recorded its first locally transmitted case of COVID-19 earlier than Italy, but its death rate is significantly lower.
The number of deaths in Germany has remained lower than many other countries, whether in Europe or around the world.
In fact, its fatality rate has remained relatively low despite a surge in the number of infections in May as social restrictions were eased. So what is Germany's secret? Germany's comprehensive mass testing is the main reason behind its success, experts say, and it is spearheaded by a leading virologist called Christian Drosten. Shortly after Chinese researchers published the genetic sequence of COVID-19 on January 10th, Drosten's laboratory team at the Charité Hospital in Berlin, Germany, created the world's first coronavirus diagnostic test. The diagnostic test was later made publicly available by the World Health Organization on January 13th. Drosten became a key advisor to the German government because of his expansive knowledge of coronaviruses.
In Germany, we have a community that's very open for establishing new diagnostic assays for several structural reasons.
His team also developed the first test during the outbreak of severe acute respiratory syndrome, an infectious disease which claimed the lives of around 800 people in 2003. Even before the alarm was sounded on COVID-19, Drosten understood the gravity of the threat. His early warnings to the media made him the face of Germany's fight against the pandemic.
The most effective way to prevent infections and save lives is breaking the chains of transmission. And to do that, you must test and isolate.
Germany's early understanding of the virus created a sense of urgency. Even before the country recorded its first case on January 27th, laboratories around the country were already stocking up on diagnostic tests in large quantities. This graph highlights the importance of early testing. Not only was Germany more decisive, it also conducted tests much faster. Until the end of April, Germany had conducted more tests than its neighbors. By mid-March, it was clear Germany's preparation had paid off. Despite the rapid rise in the number of confirmed cases, its focus on mass testing had allowed experts to study the spread of the virus and to nip the transmission chains in the bud. The expansive testing also ensured that the asymptomatic were isolated early while the sick received early treatment, strategies which experts say have reduced the mortality rate of COVID-19 in Germany. Another strategy that has allowed the government to study the spread of COVID-19 is contact tracing. This works by identifying and monitoring an infected person and the people he or she has come into contact with. While the idea sounds easy, executing and making sense of all the data isn't. The government's tracing is so meticulous that it even identified a salt shaker at a company canteen near Munich as the source behind an early community spread. The German government was one of the early backers of a centralized contact tracing strategy that tracked infected cases using a device's location data. This proposal was eventually ditched due to privacy concerns. It has since backed a decentralized approach that allows Germans to voluntarily provide data on an application, which is in line with a system being developed by Apple and Google. As the country's effective testing and tracing strategy limited the spread, its robust health system also prepared to treat those already infected.
We have a high number of ICU capacities here in Germany. We have managed to increase it now in the crisis up to 40,000 ICU beds here, and that is a high number for a country like Germany. So we took it very serious from the very beginning, and that gave us time to prepare.
And he's right. Germany was well equipped before the pandemic. In January, it already had 34 intensive care beds with ventilators for every 100,000 people, while Italy only had 12. Germany has also increased its overall intensive care beds from 28,000 in 2017 to 40,000 in 2020. Because of its well-equipped hospitals, Germany's health system was not overwhelmed, allowing it to treat other patients from Italy, Spain, and France. In the city of Heidelberg, Medics were also mobilized in corona taxis to check on infected people at their homes. These healthcare workers would conduct blood tests just 5 or 6 days after a diagnosis to assess a patient's risk of decline and refer them to hospitals if necessary. All these factors working in tandem at a local and federal level have given Germany the upper hand in the fight against COVID-19. This has allowed Germany to slowly resuscitate its economy. In May, German Chancellor Angela Merkel announced the reopening of all shops, schools, and even the country's football league, although with no spectators. Her government has urged Germans to abide by the social distancing rules to mitigate the risk of a second wave. The easing, however, depends on the number of infections in a region. Restrictions will be reinstated if the number of daily new infections exceeds 50 per 100,000 people in an area until the number subsides to less than 50 for 7 days. Germany continues to be a model for other major European countries who have suffered missteps at the early stages of the pandemic. As the country continues to ease restrictions, only time will tell if its reopening strategies will keep its death rate lower than its peers. Thank you so much for watching our video. We want to know how your country's government is responding to the pandemic. Comment below and don't forget to subscribe.